Alright, it's time to make that decision that no runner ever really wants to make. I have to stop running. How's it going, runners? My name is Justin Thompson. I'm your average running PT, and I help the average runner achieve their own personal elite status. If that's something you guys are into, then go ahead and hit that subscribe button and click the bell so you know when the next video comes out. So I have an injury, and it's normal. Every runner gets an injury at some point, even if you're as careful as you can possibly be. Even if you're a PT and you do all the right stuff. Every now and then, sometimes the body just breaks down, even if everything is going perfectly. And now I can attribute this to a specific thing that was non-running related, actually, for the initial flare-up of this, but obviously continuing to run is continuing to irritate it, and that's not helping anything at all. So I am having to make a decision to stop running for right now. So why? What is this injury that you're dealing with, Justin? What is going on? Why all of the sudden? Well, if you have been following my Strava over the last couple of days, few days, you'll notice that I have been I either took the 2 days off last week, or I've been running on the treadmill really easy. And I've been trying to kind of monitor and see what this injury was going to do. Unfortunately, it just keeps getting a little bit worse every single time that I run, so I am having to make that decision to put a pause on the running for right now. That doesn't mean I'm putting a pause on running forever, but it does mean that I am going to have a couple of weeks that I am going to be set back in trying to achieve my goals for 2021. So, what is this injury that I'm dealing with? Well, I've got this medial knee pain that I am dealing with that I've not only dealt with right now, but it's actually a chronic issue for me that does happen from time to time. And it's one of those things that there's a structural issue in my knee that for the most part doesn't typically cause a problem. For the most part, it doesn't typically cause a problem. But every now and then, if I do something extra or something changes, that structural issue will make itself known and I will have to take some time off. It's something that I have to learn to deal with. It's something that I have to kind of just work through from time to time. So what is this structural problem? What's going on with my knee? Well, ever since college, remember I was a college soccer player. I played soccer for about 20 years, from 5 years old to 25. Okay, so ever since college and a little bit after college, I've had this medial knee problem. But I think it's because the knee joint itself is a little bit unstable. Okay, so the knee ligaments, I think, have been stretched just a little bit. So if you think about, if you're walking and your knee, it kind of bends back and forth like this, right? It'll bend back and forth just like this. Well, I think when I walk, my knee kind of comes apart and then bends. Comes apart and then bends, and then I put weight back on it. Comes apart and bends, and I put weight on it. I feel this instability, this constant separation of the joint, and I think it's a medial collateral ligament instability. But I also think there may be a little bit of meniscus damage because the medial collateral ligament actually attaches into that meniscus. So that's what creates this instability for me. Now, what does that lead to that I'm actually feeling right now? Because that instability is not a huge issue for me typically. But because of that instability, it has a tendency to overstretch from time to time. So I end up getting what's called a pes anserine bursitis. And I'll put some pictures up on the screen so that you guys can see what I'm talking about. But it's right there around that medial knee, right over that MCL, right over that medial collateral ligament. And then there's 3 muscles that actually run over that bursa right there on the medial side of the knee. Okay, like I said, it's called the pes anserine bursitis, and that pes anserine bursa is three muscle tendons roll right over that bursa. One of them is called your sartorius, the second one is called your gracilis, and the third one is called your semitendinosus. And those three together are called your pes anserine tendons. Okay, and they actually form a little acronym. This is how I learned it in school. SARGENT, SGT, sartorius, gracilis, tendinosus, semitendinosus. Okay, so if you're needing a little anatomy lesson, there it is for you. So as I put these pictures up on the screen, you can see that as those three tendons run right over that bursa, it can become irritated. Okay, especially if I'm trying to support that medial knee instability with those three muscles. Okay, those three muscles are helping to provide active stability to that knee whenever I'm running. And then if I don't provide that active stability, then it's going to create a lot of tension on the medial collateral ligament itself, which is also a problem. Okay, so those three tendons are just in overdrive right now, and it's really irritating and rubbing on that bursa. Okay, so what do I plan on doing about this? So I'm going to, over the next few videos, kind of take you through my rehab process. And I fully expect to not be able to run again for about 10 days. So I'm having to kind of pivot a little bit and just kind of show you guys what am I doing to get back to running. And like I said, probably 10 days, potentially 2 weeks. If it's really bad and I just can't get it to calm down, it might be 3 weeks. And this is really hard for me because I just took a 2-week break only, 3 weeks ago? And now I felt like I was actually getting back in shape again, felt like things were coming back around, and then boom, there's a little injury. But I know that I can't push through this one. I've tried before. It's something that I need to take care of. And so what are some of the things that I'm going to do for this? I'm going to do some topical stuff, some like CBD oil, some laser therapy. We have a laser at my office that actually helps with increasing blood flow to the area and increasing tissue regeneration. There's also anti-inflammatory measures that I plan on taking, not necessarily ibuprofen and things like that, but things like curcumin tablets, turmeric pills, things of that sort that are natural, but that have really good anti-inflammatory properties. Things like, certain teas and things like that that can bring down inflammation. I do plan on doing these types of things. Things that I'm putting in my body, things that I'm putting on my body, and things that I'm doing to my body. What are the exercises or things of that sort that I'm actually going to be implementing and doing to help to not re-irritate this thing over and over and over again. Okay, so I also plan on potentially getting a massage, like a deep tissue massage, in and around those three muscles, because those three muscles, like I said, they're in overdrive right now, and they're really bound up, and I can really feel some of the tension in the muscle bellies themselves, and it's putting a lot of tension, a lot of stress on the tendons, and therefore a lot of stress on the bursa. So over the next few videos, I plan on taking you through some of the things that I am going to be doing in order to kind of calm this thing down, okay? But number one, if I don't stop running, it's not going to calm down. So that's the point of this, is this really hard decision that I'm having to make to not run for at least the next 10 days, potentially 2 weeks, and maybe even longer if things don't respond the way that I want them to. Okay, so really, really sorry about that. I know that Strava is going to be a little silent for right now, but always kind of check back in on me, because I might record walks and stuff like that, because I definitely still want to be walking. I'll definitely be walking with my wife. I might even ride the bike a little bit. Who knows? We'll see. Or who knows? Hop on the rollerblades? We'll see. So anyway, that's all I've got for you guys today. So stay encouraged, because I will be back. Don't worry. Now head on out there, seek your elite. God bless, and I'll see you next time.